Good morning, good afternoon, everyone. A very warm welcome to this webinar. I'm so delighted we're all here today um, and sharing this really important um, topic. So my name is Namita Datta, and I work at the World Bank based in Washington, D.C., for those of you who are not in the World Bank. I am program head of a global program called Solutions for Youth Employment. It's based in the World Bank. It's based in the Social Protection and Jobs Global Practice. And what S4Y does is bring together quite a large number of partners, private companies, foundations, donors, bank teams on the agenda of youth employment. A few months ago, we published a discussion note, and this discussion note was asking a really simple question. So the question was that during COVID, we saw a lot of news talking about the appalling underinvestment in the health sector, right? We all saw that. Um, Moreover, not just underinvestment in health, but we also saw news about underinvestment in the health workforce, and kind of linked with the underinvestment in health generally. And we also we heard news about how we need to be creating at least 40 million more jobs in the health sector by 2030. So on the one hand, we were listening to all of this and reading about all of this, the lack of a trained health workforce in several of our client countries. On the other hand, we also keep hearing news about just this large, persistent development challenge of youth unemployment. 64 million youth unemployed, 145 million youth living in poverty. And so the question in this discussion note was a simple one. Can we not put these two challenges together? And really, can we not have the Ministry of Health and the Ministry of Labor or Youth Employment kind of put their heads together to see if there might be a win-win opportunity to address the investment that we need in the health sector for stronger health systems, as well as create more opportunities for the youth in those very same countries. And in this discussion note, we particularly highlighted three kinds of health roles that might be very attractive as entry-level positions that might support the development of the health system, but also provide opportunities for the youth in those countries. And we said, what about entry-level non-clinical support roles in the health sector, like orderlies or people in health administration who are not trained health workers, but really important for a robust health ecosystem? So that's one. The second, we highlighted the opportunity in digital health, and we had a really interesting webinar a month ago where we had colleagues from IFC really talk about how you want to be thinking about digital entry points across the value chain in health, and how this large amount of data that's being thrown up by wearable devices, etc., could be a really interesting input to preventive health. That's number two. And number three, the care economy, where there might be opportunities to support care for children, but also care for the elderly. And this in turn can free up women to join the labor force and hence also create more jobs for women. So these were the three ideas that we had put in this discussion note. We had a really vibrant discussion in a webinar. And why we are here today is sort of a follow on and asking another question. What might be some interesting ways we can think about to address this shortage in the health workforce and partner with the private sector? So that's the topic for the discussion today. And I'm really delighted that we are putting this session together. It's a partnership between S4Y and the Skills Global Solutions Group. And we have three really interesting speakers, all bringing in their different perspective. So we have Arunesh Singh. Arunesh, really wonderful that you're here today. Arunesh is CEO of Generation, and Arunesh will tell us a little bit what Generation is if you don't already know. And we have also Nobu, my colleague Nobuyuki Tanaka, Nobu, who is in the global unit in the education global practice of the bank. And he will bring in the perspective of what does it mean for education systems to address this shortage in the health workforce. And then we have my colleague Miki Chopra, who is in the health global practice. So he's global solutions lead for service delivery in the health, nutrition, and population global practice. So three very different perspectives. So I'm going to invite Arunesh to kick it off, and then have Mickey and Nobu comment on it and bring in their reflections. And I just want to encourage everybody who's joined here today to mute themselves while the speakers are speaking, but please feel free to put in your questions, your comments, your reflections as you hear the speakers speak in the chat. We are going to record this session and hopefully share with those who, several of our colleagues who said they may not be able to join today, but they would want to listen to the recording. So with that, I'm going to shut up and over to you, Arunesh, and a warm welcome.
Thank you so much, and thanks for having us today. It is a pleasure to be here. What I'll do is, I'll present for about 15-ish minutes, talk to you about generation a bit, and then specifically walk you through the work that we did during the pandemic. So let me share my screen.
Nothing happening, Arunesh, yet. And we lost your video as well, but maybe you switched it off. Arunesh, can you hear us?
Can you hear me?
You faded out, but I can hear you now. Okay,
All right,
something's
I'm switching off camera just in case. Can you see my screen now?
It's something is happening. I can't see anything though. Like I can't see the slides come up, but yeah, there you go. We got it. Yeah, maybe you can put it on full slide.
Is this visible now? And can you hear me all right?
Yes, perfect.
Apologies for that. Somehow this always happens. Anyway, so continuing. Generation is a global, train in place organization. We were founded by McKinsey and Company 5 years ago as part of McKinsey's social initiative. And like I said, we train in place adults into careers that would otherwise be inaccessible to them. We are, like I said, in 17 countries, and we started off with 5 countries, India being one of those, and we are set up as a non-profit across all the 17 markets that we are in. We measure ourselves across 3 parameters. As you can see, the first is breadth, which is really about, how many learners or the volume of learners that we are able to sort of bring into our system. The second is, let me just sort of, double click on the first one, which is breadth. We are at about 70,000 plus learners across, 17 markets now in 269 cities. So it's quite a large spread globally. Depth for us really means outcomes that the skills sector, the majority of the work that's being done focuses largely on training. But the success metric very rarely goes towards, job placement, income outcomes or wage outcomes, and then, how long people stay in the jobs, and that's retention. As you can see, for us, our placement percentages are 81%. We are able to have 3 to 4x increase in income, so fairly better wage outcome than as far as our learners are concerned. And the last bit, which is about durability, which is a sort of more sustained long-term impact on our learners. And as you can see, about 70% of our learners are able to meet their daily financial needs. 40% are able to save, which is a huge and important thing for them. So that's largely the matrix that we hold ourselves against. We also work in a very diverse, we have a very diverse range for learners. A vast majority of our learners are in the age group of 18 to 29, but we are also beginning to work now with adults, who have been out of work, and we're trying to get them back into work. our education levels, about 54% are, high school or less. In India, just sort of give context, it's more than 95%. So, in fact, what we would say is that we train people who are referred to as NEET. That's not in education, employment, or training. So they are not in anybody's radar really. And, therefore the need is the most among such people. By gender, 53% of our learners are women, and by their financial situation, 42% sometimes don't even have enough to meet their daily needs. So that's the sort of diversity of our learners. Uh, Now, excuse me, all that we are able to do and achieve that whatever we are able to achieve is largely because of the seven-step methodology that you see in front of you. This is a holistic, demand-driven methodology, which is looking at skills, as a continuum, right from, identifying the jobs, and then sort of getting into the right training, ensuring that the training is beyond just technical training. It goes into behaviors and mindsets. One of the typical things about us is that we don't stop at training. We ensure that our learners get jobs, and therefore you would see our placement percentages are very high. We create social groups, we have mentorship programs, and then we have a very positive ROI, both for our employer as well as for our learners. So, and data is really at the center of everything. So this is a very holistic methodology. It's very horizontal. You can take it from one job role to another, one country to another, one continent to another, and still be able to achieve the same outcomes that we speak of. We are in several professions. Tech, as you can see, we are in several professions in tech. Healthcare has been a huge focus for us, especially in India. And I'll speak of our work in healthcare in a bit. And then, customer-facing programs, skill trades such as machine operators or a swing machine operator. And very recently, we started work into green jobs as well. Excuse me. Now let's get to the pandemic. Now we know that India particularly had three severe waves, two of which were well, I don't think there's anybody in the country who can say that they were not personally impacted by it. So clearly, it sort of uh, opened gaping holes, as Namita was just saying, as far as lack of sufficiently trained medical staff, or just the sheer inability of having that kind of capacity. So as sort of a training organization, we said, look, there is something that we have to do about this, and that is where we thought that at the least as our contribution towards helping mitigate the problems of the pandemic, we would at least create some kind of a training program for people. And then it emerged that we should do something for nurses. This basically started in Italy, and then once we'd taken some learnings from Italy, we started sort of replicating those into India. What did we do? The value proposition was simple. We worked with healthcare partners to create a contextually relevant, very high quality video-based e-learning module for nurses. This was in simple words, this was a nurses upskilling module. You already have nurses, they know what they have to do, but because we were all hit by the pandemic so suddenly, people needed that their skills to be upskilled. So that's basically what this program was. It was online. It was video based. It was very simple to sort of absorb the content. The curriculum was accompanied with an assessment, so nurses could sort of benefit from it. And then finally, it was accessible online for a very quick referral at any point in time for anybody, whether you're a nurse or a junior doctor or so on and so forth. Like I said, it started with Italy, and then started sort of replicating that, customizing it by country. And by the time we started doing that work in India, we had created, we were ultimately able to train about 120,000 nurses through a very robust, partnership and a coalition, which I'll speak of in a bit. Now, what we were really trying to do is to ensure that we are covering, pretty much everything that a nurse requires in being able to sort of address the needs of the pandemic as a nurse. So the first, the content, as you can see in front of you, is part of the first thing was the personal protective equipment, the PPE. While when we were implementing the program, we realized that a vast majority of nurses had never used a PPE. because they had never been in a situation like this. Then, of course, the basics of infection prevention and control. Then the role of the nurse, at the time of sort of handling the COVID patients. What are the symptoms? What are the treatments? What are the roles and responsibilities of a nurse? How do you set up isolation ward or an intubation? So all of that was sort of, ensure that this is they get upskilled through this, online program. And of course, finally, also, how do you take care of yourself? We all saw that nurses were highly distressed during this entire, episode across the world, and something had to be done for their mental well-being as well. So, or just their simple sort of healthcare needs. Now, how we achieved this is, as an organization, we are a curator. We create content, we train people, but we are not subject matter experts in terms of, what content needs to go into a healthcare program. So, we partnered with a subject matter expert of Columbia Asia, which is a fairly famous hospital in the country, hospital chain in the country. They provided the content. They got the medical, sort of group together, and a panel of doctors who sort of basically certified sort of the right content to be in place. Then we had a nursing association which provided the accreditation through this is a ministry, the ministry body, Ministry of Health body, which sort of provided the certification or accreditation for the content. And then we had industry partners who would ensure that this gets spread. The media partner would ensure that they're sort of spreading the word, talking about it, so that people are sort of taking this course. And then we had various implementation partners, the largest being LearnIt. LearnIt is one of the largest skilling, training partners in the country. So this is the reason, we were able to sort of take it to 120,000 nurses. And as you can see from, the surveys that we ran, 90% of the nurses rated the quality of the course to be excellent or very good, and 99% of the nurses found the training to be very useful for their current scope of work. So it was very relevant. So that's essentially what happened, and we are very happy and glad that we were in some way or the other able to contribute towards mitigating, all the risks of COVID, and that we were in fact able to train 120,000 nurses across the country, which is a large number by at least Indian standards. I'll stop here, and for any questions that you might have.
Thanks a lot, Arunesh. I see that there's one question in the chat, but maybe we'll come back to it, which is really about the placement percentage. But I think you had it on your slide. But that is one. The other question I had for you, but maybe this is going to be, we'll come back to it, is I was curious. I mean, you talked a little bit about how you responded to COVID, but if I remember correctly, and I've seen generation from the time it was born and created and just thinking about its strategy, that you were very smart about thinking about health right from get-go, even before COVID. You talked about your COVID response,
Yeah.
but I do recall health was one of your sectors right from the beginning, and I wonder why. Because you're also an organization, I know, that's very focused on metrics. So I was just curious what kind of demand assessment you may have done, but we'll come back to that. Or maybe you want to quickly respond, or
Yeah, I can respond to it right now. I think it's a very relevant question because, my response to this from a COVID perspective. But yes, healthcare has been an extremely important sector for us. We used to and continue to train for a general duty assistant job role in the healthcare sector. A general duty assistant is the person who works below a nurse in a hospital. Now, if you were to look at the hierarchy in any hospital, you would find that this is a pyramid, and the largest number of jobs in any hospital is that of a general duty assistant. So this is a healthcare job, which is something that we wanted to focus upon. There's huge growth matrix in as far as healthcare in the country is concerned. And the second thing is that the volume is huge. That you're able to address, and you're able to take people who are just 10th or 12th pass, give them a 4 months training, and then have them work in a hospital general duty assistant. So you're able to do several things at the same time. You're able to get people who are not trained or educated into a formal job, you're able to get them above minimum wages or at least minimum wages, and then you're able to get them into a sustained employment,
Mm.
which otherwise would not have been accessible to them. Therefore, for us, and then it's the healthcare sector, which is as a non-profit something we wanted to focus upon. And largely, and lastly, the healthcare sector, the growth is very high in the country. Because we focus on jobs, you will find us in those sectors where we are able to ensure that people get jobs. So that's the reason why the GDA job role was very important for us and continues to be.
Yeah. And I'm also curious because you operate in 16 countries. I'm curious, how are there any differences in the healthcare? But I'm going to park that question a little bit. I don't want to misuse the privilege that I have of being moderator by asking only questions that come to me. But over to you, Mickey. You want to comment a little bit on what Arunesh shared, but also maybe reflect a bit on your work in the health global practice. Mickey?
Thank you, Namita, and Arunesh. Really, thanks for that too brief an overview of what you've done. I'm sure there's a lot more that we should be unpacking and exploring, and I hope we can do that in the time. So I'm not going to spend too much time at this moment, but to allow for us to explore more. But Namita, I too was very excited by the working paper and the concept note around the potential. Apologies, for health work as a growth part of the economy and as an opportunity, particularly for youth employment, but also for female employment. As you know, it's in many countries, it is one of the major ways for to get good for educated and even less well educated girls and women to get into the job market. So what I wanted to do in sort of just as my opening remarks, as it were, was sort of reflect on three sort of paradigm shifts, which I think are going to be necessary if this agenda is going to go to scale and it's going to be more than just a once-off sort of COVID type of response. And how do we sustain, as you said, Namita, in your opening remarks, how do we sustain the attention and the energy and focus that was given to this sector? How do we make sure that doesn't just dissipate away and we go back to the pre-COVID situation? And so we're much better prepared next time round, for example, as well. So the first paradigm shift is how indeed do we look at this sector, health and healthcare, and shift from a welfare perspective to a economic, productive part of the economy perspective. So as you're all well familiar, in many places, Arunesh, you work in the US and Europe and even South America, the health sector is one of the fastest growing parts of the economy. And actually, it's not just a welfare, but it's actually a very productive part of the economy in terms of generating new innovations, new knowledge, and it's obviously as incomes rise, and then people's consumption of health increases much more at a faster pace than other goods that they want to consume as well. And I'm sure nearly everyone on this call will be familiar with how health becomes a major concern and people willing to invest and consume more healthcare. So indeed, how do we move the ministries of finance to start to think about health as just as they think of other parts of the economy, whether it's car manufacturing or steel manufacturing? How do they start to look at health as a productive part and then as an opportunity to create well-paid, relatively well-paid, but more importantly, rewarding jobs, particularly for women in their society? So I think that's an important paradigm shift that's going to be necessary if we're going to take these initiatives to scale. The second paradigm shift, moving much more to the sector specific, is, and to put it in macroeconomic terms again, is how do we move from an approach in the health sector, which is basically a Fordist approach to healthcare, to a post-Fordist. So in other words, traditionally, particularly at the nursing and that level and other sort of health professional levels, it has traditionally been seen as a conveyor belt, that you basically are just taking care of patients as they come through hospitals, changing bed sheets, doing routine tasks, and this sort of attempt to try and make it as routine and mundane as possible, to a recognition that you know, in the 21st century, as people are getting older and having multi-comorbidities, complexity of care has increased substantially, and that you need lifelong care and a completely different way of approaching healthcare, not just as a once-off being in the hospital or seeing in the clinic, but actually accompanying people through their life course, and particularly towards the end. So how do we start to treat healthcare, the training and the role of healthcare workers as ones who are co-owning, if you like, the process, and are moving to being skilled teams, multidisciplinary teams, and so forth. So that requires a whole different types of skill sets than are traditionally being taught in the medical education, nursing schools, medical schools, and the kinds of interventions that Generation Maker have made, you know, a very important role in that. But that does require a different way of how we perceive the work of what healthcare workers do. And then coming from the health sector down to the looking at the skills aspect, the third paradigm shift I want to suggest, which builds on the first two, is really this change in attitude of a once-off training, and you qualify and you basically are a nurse or a doctor or a physiotherapist, the one of lifelong learning and picking up new skills, and how do we incentivize that? And we saw this in COVID, as Aranish mentioned. You know, we've got a study which is being reviewed in Nature at the moment, looking at the cost of COVID infections and COVID deaths in health workers across a number of countries, and it's quite horrific in terms of the not just the obviously it's horrific in terms of numbers of deaths, but if you look at the cost to the healthcare system, but also to the economy more broadly, because when you lose healthcare workers, you have more preventable deaths, and those people themselves then are often breadwinners and productive members of the economy. It's massive. Hundreds of millions of dollars were lost because of poor safety and infection control in hospitals, partly because healthcare workers themselves were not doing the right things and were not trained to do the right things because they had not had that continuous learning component to it. So just, Namita, just to sort of lay out sort of three sort of big shifts that are happening, but we need to accelerate if this agenda is to go to scale. Thank you.
Thanks, Nikki. And I know that behind each of these three paradigm shifts, you must have like a billion sort of thoughts, and you must have done quite a lot of work. And I was just curious, and maybe we come back to this in the discussion section. I was curious whether if from your experience, you can share insights from any country experience that may have successfully implemented or begun to implement one of these three shifts that you're talking about. Like the proof of the pudding is sort of, it's really the nuts and bolts of how you do these paradigm shifts that really are tricky and complex. They're associated with. I mean, the one thing that I thought when I was listening to you was, what if every country started really doubling down on investing in the health workforce? Would there be a situation where there's then a glut of trained health workforce? I mean, you've got to also address the demand for the health workforce, right? You can't. So how do you do both at the same time? It's a little bit like power. Like you set up a power plant in a particular country. If there's no offtake for that power, then it just sits there. And on the other hand, it's a chicken and egg thing. There's no industry that comes here because you haven't invested in power. So I was wondering how one addresses some of the simultaneous issues of investing in demand as well as the supply of health workforce. But maybe we'll come to that in the discussion section. But over to you, Nobu. Nobu, one of the paradigm shifts that Mickey mentioned really has to do with the education system. So I wonder if you could reflect a bit on that. So over to you, Nobu.
Thank you so much. It is my pleasure to be part of this discussion with colleagues working in different areas, education, health, and social protection today. So engagement with industry at the beginning, provision of the short and targeted training packages, including technical, behavioral, mindset training, together with mentoring support. We also see the job placement support and online training. So from CEO's presentation, we learned an excellent holistic approach today. So especially upskilling existing healthcare workers. Also, the impact and outcome of the training are remarkable. So here I would like to share the two points as discussant from education sectors. So my first point is about applicability of this approach to the practicum aspect in pre-service training. So it could be part of the long-term degree programs or short cycle diploma courses at Tibet, technical vocational education training, and higher education subsectors of education. Curricula and the delivery of the program need to meet labor market demands. So please think about students enroll in College of Nurses, student in School of Education, or student in technical institutions who want to work in the renewable energy field after they completing their training. So it is critical that those students acquire skills and knowledge through market relevant programs and also have the practicum experiences while they are in training institution. For example, internship. So practicum aspect is taken into account through the whole spectrum training, from the identification of the training needs, design curricula, implementation practical training, both at the pre-service and in-service training. Yes, we know it, but we also know it is not necessarily easy to design, develop, and implement highly relevant program, including practicum experience, due to several reasons. For instance, maybe it could be because information gap on the industry needs, or maybe financial constraint to deliver the program, or challenges in building partnership with the private sector itself. So it is important to know how we can actually attract industry, particularly private sector, to support and train students at the stage of pre-service training. Also, how does online training help connect students, trainers, and industries? CEO, in your presentation, I saw Generation India actually supports both nursing students and nurses. So it would be great to learn more about the potential further application to the pre-service training. So this is my first point. Let's talk about the Tibet and higher education. So my second point is here. I want to touch on key workforce in the education sector. Yes, it is teachers. Here is a statistic we have. So world faces a huge issue on the foundational skills of children and youth. It is a learning crisis. Children under the age 10 in low and middle income countries cannot read and understand a simple text. And then this results in a skills crisis that affect working ages population in many low and middle income countries, as 750 million people age 15 plus are reported to be lacking literacy and numeracy skills. So much of the global workforce lack the skill required for labor market success in a greener and a more technological digital world. So basic literacy, numeracy, and socio-emotional skills are the building blocks for the learning throughout life. So in your presentation, so your training covers different occupations we learn, including healthcare, tech, sales and customer services, skills trade, and the green job. We'd like to know whether we could use this approach to train the teachers to equip new skills and knowledge. For instance, digital technology for remote teaching and learning, such needs became evident by COVID-19 onset and school closure. So these teachers and education professionals define the quality of education system. So again, pre-service training and the continuous professional development for teachers are both critical. Of course, we may need to here consider one aspect in teaching workforce. That is, in many countries, the main industry who need teachers and the major employers of teachers are public sectors or the government. Whereas in some countries and regions, such as South Asia, the private sector has more presence than the others, but teacher training programs tend to be government regulated. So in the health sector, generation is engaged with state government, national accreditation body linked to the government, the case Ministry of Health, and the service providers, for example, the hospitals. So we'd like to know if we could apply the generations approach to the workforce in the education sector. Here again, the teachers who are both in the public and the private sector. If not, what aspect of your approach could we bring into the education sector to improve the teaching workforces? So these are the two comments from my side. So I hope my comments are useful to steer our discussion today. Thank you so much. So back to you, Namita. Sorry, Namita, it seems you're speaking but on mute.
Oh, yes, thank you, Nobu. I was speaking to myself. So Arunesh, we'll turn it back to you to reflect a bit on what Mickey and Nobu said, in particular, this issue of training the trainer. How do you do that, and whether you've thought about it in your program. And then also this issue of partnerships with the private sector, and at what stage, what is in your experiences is workable in terms of partnering with the private sector, and where do you see gaps? And then also there's a question in the chat. I think it's addressed to you, Arunesh. It's about regulations that restrict general duty assistance, which you mentioned is one of your priority areas, and how do you overcome some of those regulations? So over to you.
Sure. So, to respond to your question, let's step back a bit and try and understand, what does the skills space sort of look like in India? And then what is it the generation's really trying to achieve? Now, when I was speaking, I did mention to you, when you look at the TVET outcomes of India, you will find that the outcomes are fairly strong when it comes to training completion, which is what's referred to as certification, right? However, if you were to sort of look at outcomes as regards employment or as regards retention, those numbers are very, very, very poor. Depending upon who you're speaking to, these could be as low as about 20%. Uh, so, if you look at that funnel, that if 100 people have been, sort of enrolled, and, through that funnel, only 20 ultimately get a job, then you haven't really solved the problem of unemployability in the first place, right? So when we started working in India, we said to ourselves that, look, we have this methodology, which, we would like to embed into the public TVET systems in the country and enhance outcomes when it comes to both employment as well as retention. So that's largely sort of the North Star of India, of Generation India, to work with the government of India, embed our methodology into the existing systems. What are the existing systems? So existing systems are large government schemes like the Pradhan Mantri Kaushal Vikas Yojana, the PMKVY, which is the national sort of flagship skills initiative of the Honorable Prime Minister, or the state level partnerships of DDU-GKY. The whole idea is to be able to then work both with the central government as well as with the state government. Now, in doing so, you work with the National Skills Nodal Agency, which is the National Skills Development Corporation, which is what we do. We work with NSTC, and we are currently implementing a large program, in fact, funded partly by the World Bank through the Sankalp project. It's called Amber, which is training 30,000 learners This is a sort of partnership, public-private partnership, where half the money comes in through the Sankalp partnership through MSTE, the Ministry of Skill Development and Entrepreneurship, and the rest is brought in by the private sector. So now let me bring in the answer to your two questions. The first is the sort of, the ecosystem. How do you get to scale in a skills program in a country as large as India without sort of addressing, how that training is going to happen? And I think the most important part for us is that you don't try and sort of duplicate what already exists. You have to work with what's already there and improve outcomes therein. Therefore, we have to ensure that the trainers that we are working with ultimately are the ones who are upskilled. There is, of course, a TOT, but the important point that I'm trying to make here is that uh, this is a high hand-holding sort of job, at least in the beginning. It doesn't sound, very sort of efficient in a way that you would want it to be. But if you want to sort of work in the system, make the best out of it, then you will have to make initial investments towards enhancing capacities of existing trainers and sort of getting newer systems, newer trainers into the system, especially for tech kind of job roles, because you have traditional job roles, what are referred to as mass employment job roles. There are sufficient trainers. I think they need to be upskilled. But to address the needs of a tech sector, or for the needs of a sort of the green job sector, the trainers don't exist, right? So you have to get new trainers into the system. When we were looking at COVID, we realized that, when we shifted our training from in person to online, the first person that needed to be trained was the trainer, because trainers didn't know how to use systems or train people in an online mode. So you have to be flexible. You have to be able to create those systems really fast, so that you are able to address things at scale. So I think that's very important. That's one, that uh, trainers are there. You have to upskill them. There are sectors that are new for which you'll have to get new trainers, and that's a constant battle. I don't think I have a perfect answer for that. Now, when it comes to investments, now this is a public forum, so I'll be careful. But see, the important thing is the skills sector has a bit of a dichotomy, that there are two beneficiaries of this sector, of any outcome of any skills initiative. One is the learner, the other is the employer, and both are unwilling to pay for it, especially in a country like India. In a public debate program, you can't charge learners because it's a public program, it's public good. And employers don't pay because this has become a public good. People have got used to sort of, entry level people being free. There are so many of them who are unemployed, and B, because they're only seen as warm bodies. So, no one is able to really see the net impact on ROI from an entry level employee, but they will keep complaining that we don't have sufficient people who have sufficient skills. So it is a bit of a dichotomy in that sense. But to enhance outcomes, you will have to have methodologies like ours that are robust, that are really going deep into the training, and that costs more. And it doesn't come free, right? Therefore, you can't just always say that it's the government's job to enhance or to increase the sort of payout per learner. The employee or the private sector will have to come into play as well, which is why Amber is important for us as a program, that 50% of the cost of the training comes from the government and other 50 comes from the private sector. It largely comes through philanthropy, but that is the participation of the private sector. And we are hoping eventually that we are able to also charge employers for it. There are some sectors, at least in India, where you are able to charge. The employer is sort of paying for it, especially the tech sector. But for mass employment job roles, it's very rare for employers to pay for learners. But once they starts getting a positive ROI, for these entry level workers, I'm very hopeful that that scenario will change as well. I'll stop you if you have any further clarifications, or if I've answered your question.
That's a really good point, Arunesh. This whole thing about market failure, that nobody wants to invest in it because, and I remember in a lot of interaction with the private sector, one of the big issues they raise also, particularly with SMEs, the small and medium companies, don't want to invest in training because they fear poaching. that if I'm going to invest in training this fellow
Yeah.
or woman or whatever, entry level person, and then tomorrow that person's going to just leave and go to my competitor. And sort of a
Yeah.
bigger level problem of this, which I've also heard a lot in the narrative, is this whole issue of migration. Like, as a government, you invest in training nurses and doctors, and this is particularly true in India. I'm aware of it, and is that you invest and put in all of this money, and then you find a lot of the nurses and the doctors migrate to other countries, and the country's investment, you don't get the benefit of that. I mean, that's the other. I know it's a very politically sensitive issue, and I'm sure Nobu have a take on it. I also wanted to just maybe give a chance now, turn to Mickey and Nobu to comment on some of the questions we are seeing in the chat. So this Sang Min is saying that in East Asia, the World Bank has been supporting health professional education in Indonesia, Vietnam, and Cambodia. And he's saying that there are some experience and lessons. And then a really good question from Mike about engaging with health sector employers. Like, have we, and collectively, I think this is a question to all three of you, have we ever used internships or apprenticeships for youth as something before you give them a full-time job in the health sector? And what might be some types of subsidies? And I think you mentioned some of it, Arunesh, that the government has to step in with some kind of a subsidy. And then another question from Eric, and I'm just reading out these questions so that you particularly Nobu and Mickey can pick any of these and comment on it. And then Eric is curious. He's saying that about outside technical skills. Are there any soft skills that you think are particularly important for people who are trained in the health sector? And I think you did mention some of that, Arunesh, in the beginning. And then a question to you specifically, Arunesh, is an estimate of what is the cost that your organization, what is it what is the cost per student? But before I go back to you, Arunesh, I just want to give Mickey. Mickey, maybe you want to go first, just to comment and reflect a bit on what you've heard.
Thank you, Namita, and thanks everyone for the questions and comments. Maybe also to answer your question, Namita, that you posed as well to me earlier about the demand and for these jobs as well. So yeah, I mean, I do think this whole point about labor market failure, to what extent is that prevalent in this sector? So we have in the last 10 years been undertaking a series of analytical work across different regions on labor market analysis for the healthcare sector in specifically. And so I'll try, after I finish talking, putting some links up for some of those publications for those people who are interested, but completely agree with you that and what they're finding indeed is that there is quite significant market failure, not just in terms of Aranesh's point of either employees or employees being willing to invest in further training, further education. As you know, there is quite a lot of investment by individuals and families into the education, particularly for healthcare, but continuing education once you're in the system. The main mechanism that's been used is the regulatory way. Many countries now have introduced the need for continuing medical education and continuing accreditation of healthcare workers if they want to continue working. Now, implementation of that is very variable, and that's the key thing, is that countries such as South Africa, where I worked for many years, are quite stringent and enforce that need, the CME as it's called, and therefore there is quite an industry in continuing medical education in South Africa, whereas in India, for example, it's been much more challenging to enforce that. So the regulatory and the enforcement of those sort of regulations, as a comment that came earlier, is also a key component of this whole agenda as well. Yes, thanks. You're absolutely right that Sangmin, that we have been investing, particularly in East Asia, actually, on medical education, and there's some good learnings from there. I'm speaking from the top of my head. But it's interesting that in Africa and South Asia, we've stepped back largely from investments in medical education, and Nobu may have some insights there. I haven't looked into this as closely, but my sense is that it is because the private sector has come so much into this space that in Africa and South Asia, there's in the majority now, in many contexts, those private medical schools and nursing schools in the private sector. So governments have not been so keen to spend scarce either resources on medical education. But I do think this is an area that we should, we have been just talking to our education colleagues about, because of the need for better quality and high quality medical education than what we're seeing at the moment. These are the changing needs. I'll stop there. Thanks.
Thanks, Mickey. Nobu?
Thank you so much. Maybe I want to respond to one of the question on the specific life and the soft skills. They mentioned in the discussion point that foundational skills is critical. That is the building block for the next level of the skills. So foundational skills actually include the literacy, basic literacy, numeracy, and the socio-emotional skills. So all of the important need to be addressed at the earlier stage. As I said, it's a learning crisis. It's a huge number of the youth or children and the youth, they cannot read and simple text message by the age 10. So I think this is something from education perspective we need to address. And then they work on together with the partners, with health team and others. Thank you.
Nobu, I would say that in addition to numeracy and literacy and the foundational skills, I would say digital literacy is now as foundational. I mean, and in the last webinar that we had was really a fascinating presentation by Charles Dalton in IFC, who really tracked how at every entry point, and to the point that you were also making, Arunesh, is that when you had to pivot to video, online systems during COVID, a doctor or a nurse needed to know how to get onto Zoom, for example. It's just as simple as that. And now telemedicine is picking up. And he also talked about how the health sector is going to need certain types of jobs that don't even exist today, that we haven't even anticipated. This whole remote surgery, using AR and VR, digitizing health records, sort of care and predictive analytics, like the sorts of skills that we probably don't even know that we might use in the health sector. Mickey, you want to say something? Yeah.
Yes, sorry, Namita, thank you. So one thing I forgot to also, the point you raised was about mobility and migration, which is a key feature of this sector as well. So I just put in the chat a link to a recent study, well, not so recent now, 5 years ago, from East Europe. So I do think we're showing quite large migration effects, so mobility. So I completely agree that this is another analyzed, if you like, or I mean, obviously at the global level, there is a continuing discourse around the fact that there are more Malawian doctors in Birmingham than there are in Malawi in the UK. But in terms of the even within regions, there's a fair bit of internal migration going on in Africa, for example. So absolutely, just wanted to flag that as well as a key issue. Thanks.
And then raises the issue of certifications that are recognized globally, raises the issue of who funds what, and the incentive to fund. So yeah, this is complicated. But back to you also, Arunesh, if you want to reflect on a few things. There were a couple questions that were very specific about your program, including cost, and also there was a question that I think I overlooked about how you manage the different stakeholders for your program.
Yeah, so let me go backwards and sort of start with the last question first. Typically cost per student would be in the range of about $200 to $400 depending upon per student, depending upon the job role, right? So a general duty assistant would be in the range of about $250, but a tech role like a junior full stack developer could be $400 $450. So that's sort of the range. Typically, these are short-term skilling programs, so they would last anywhere between 6 to 12 weeks. Again, depending upon the job role that we're talking about. So that's on the cost per learner. Just to add to the sort of discussion on skill sets beyond technical skill sets, what sort of specific soft skills that you need to sort of impart. And so we are a very firm believer of behaviors and mindsets. In fact, 60% our curriculum is sort of focused on behaviors and mindsets because we strongly believe, and these have to be customized to the job role. The kind of behaviors and mindsets a general duty assistant requires are very different from a retail sales associate, who needs to be sort of selling in a decathlon on a retail outlet vis-a-vis a person who's working in a hospital. So I think the fact that they need to be imparted, and B, one size doesn't fit all. You'll have to customize it to the industry. And I think that's very important. And then beyond just behaviors and mindsets, there's another very important aspect which is perhaps true for an India context, is they need a lot of mentorship support. You see, our learners come from tier 2, tier 3 towns, from socioeconomic classification C and D, which is poor to near poor. Um, what that means is, they have never done jobs before. So, and they are going to a state capital or to a district headquarter for the training, and to a metropolitan town for the job. So just think of the social support that they're losing in doing all of this and doing it for the first time. So in our programs, we have clinical psychologists who support our learners for a period of 6 months, 3 months into the training, 3 months into the job. And the job of the mentor, as we call him or her, is the mental health of our learner. Not to retain them into the job. That's somebody else's job. We just want to make sure that their mental health is taken care of, that they have someone they can go back to and ask questions that they can't ask a trainer, or they can't ask even their peers, right? Because they've never, sometimes they get bad bosses. How do you deal with that? So that's what a mentor sort of helps them do. So I think those are important aspects of sort of technical training, behaviors and mindsets, and then sort of ensuring that there are systematic, mentorship or sort of clinical psychological help that they're getting in sort of sustaining themselves into what they've set themselves up for. Then the point on internships, I think that's very important. And increasingly, the National Skills Development Corporation and the ministry is what's referred to in India as OJT, or all on-the-job training, is increasingly becoming part of almost all trades now, especially healthcare. In fact, in healthcare, for a general duty assistant, it's been made compulsory for a period of 3 months or 6 months. I don't exactly recall, but it's sort of been made compulsory now. So I think OJ or internships really help. There is, of course, a separate internship or apprenticeship program, which is sort of sponsored by the government of India. I think it's important, and if it's linked to the industry, especially the types that you have through ITIs, has shown success in some places. There's a lot of work that needs to be done, but clearly, internships are a very important part of, I think, making sure that the industry participates in the skills initiative, and that the learner gets some real hands-on experience for the job that they have sort of signed up for. But there have to be commitments on both sides. Apprentices need to be paid properly. They need to be treated well. It needs to be ensured that they're not being given million tasks to do. Those kinds of things, which is why it sort of is hugely unpopular amongst learners. I think the last one is about particularly the sort of upskilling program that we had for nurses. In India, typically, it's extremely important to work through a large range of stakeholders. Otherwise, if you want to get, especially if you want to get to scale. So, when we did our nurse upskilling program, we ensured that we had an accreditation agency, the largest sort of nurses association in the country. We had a large hospital network. And we sort of got all of these stakeholders together to sort of achieve something that they would otherwise not be able to achieve on their own. And then at a time when there was so much that was going wrong with the world. So I think what really helped us is transparency, ensuring that they get their space and that we recognize the speciality that they brought onto the table. If you have an accreditation agency, or if you have a content matter expert, then we go by the sort of word of the content matter expert and not sort of argue with the content matter expert. Otherwise, we should not have got them in the first place. So I think that's how we've managed these stakeholders. It's a tough job. Uh, but everybody was there because everybody was achieving a sort of much larger goal, and that's important for us. And we are very happy that we were able to contribute towards, to whatever extent we could, in upscaling nurses in the country during that time. Uh, I think that's the questions to me. I'll stop here.
No, thank you, Arunesh. And I mean, I think it's clear to all of us, just also looking at what people are putting in the chat and just some of the things that we are discussing, that we just scratched the surface. I think there's a lot more that we could have discussed. I really also want to acknowledge the comment that Timothy put in there about migration of nurses from the Caribbean, and how one might have to think about what are called global skills partnerships to address some of these market failures. And I also wanted to say a big thank you also to all of you who are putting, and particularly Mickey, he's put quite a few, and Sangmin has put a link to the blog on our experience in East Asia. And Mickey's put an example of a labor market analysis from a health perspective in the chat. And Sunamika has also shared the discussion note that we in S4Y put out there, just kind of bringing the two agendas of health and youth employment together. So there's a ton of resources in the chat, but just a big thank you to you, Arunesh, for spending your evening time. It must be dinner time for you already. So thank you for sharing this experience. I think we could continue this discussion. And thanks also, big thank you to Mickey and Nobu for sharing their perspectives from the health and the education global practices respectively. A big thank you also to my colleague Diego, who leads the Skills Global Solutions Group, to partner up on this really interesting webinar. We are going to put this online, and for those who missed it, I think they'll have a chance to look at the recording. Big thank you to you all for joining. This was a really interesting discussion. Thank you, Arunesh. Thank you, Nobu.
Thank you so much. Thank you, everyone.